Hello, dear students. Today we will be talking about anxiety. Anxiety is an unpleasant state of tension that have physical symptoms like tachycardia, sweating, trembling, and palpitations. Mild anxiety are very common life experience and they don't necessitate any treatment. But if the anxiety is severe and chronic, an anti-anxiety drugs will be needed. The most commonly used anxiolytic drugs are the benzodiazepines. Benzodiazepines act on the benzodiazepine site of the GABA receptor. GABA is the major inhibiting neurotransmitter in the central nervous system. And when benzodiazepine bind to the receptor, they trigger the opening of chloride channels, which will lead to hyperpolarization and inhibit the formation of the action potentials. Benzodiazepines are effective in treatment of different anxiety disorders like social anxiety, performance anxiety, and so on, as well as in the treatment of skeletal muscle spasms and also to treat the spasticity from multiple sclerosis. Especially diazepam is useful for this condition. Also, diazepam and lorazepam are the drug of choice for terminating grand mal epileptic seizures and status epilepticus. The short-acting benzodiazepines are used as a pre-medication for anxiety-provoking procedures like endoscopic or bronchoscopy or dental procedures. Midazolam is used for the induction of anesthesia. The long-acting benzodiazepine florazepam, intermediate-acting temazepam, and short-acting triazolam are also prescribed for sleep disorders. The antidote for the benzodiazepine action is flumazenil, which is a GABA receptor antagonist that can rapidly reverse the effect of benzodiazepine, and it is administered by intravenous only. Other anxiolytic agents include antidepressants like escitalopram, which is selective serotonin uptake inhibitor, and venlafaxine, which is selective serotonin and norepinephrine uptake inhibitor. These agents, they are the first-line agents in patients which has a history of addiction or dependence because they have lower potential for physical dependence than benzodiazepines, and they manage the long-term symptoms of chronic anxiety disorder. The agent which is also useful for the chronic treatment of generalized anxiety disorder is buspirone. This drug effects are mediated by serotonin, especially serotonin 1A receptors. Another group which were formerly the mainstay of treatment of anxiety, but now it has been largely replaced by benzodiazepines because of its tolerance and physical dependence, are the barbiturates. And these drugs are classified according to their duration of action. We have thiopental, which is short-acting, phenobarbital, which is long-acting, and then pentobarbital, secobarbital, and amobarbital, which are very short-acting. As benzodiazepines, they also act with the GABA A receptors and enhance the GABAergic transmissions. Thiopental, because it is very short duration of action, it is used to induce the anesthesia. Phenobarbital, it is used mainly for treatment of seizures, while pentobarbital are also used as sedative and hypnotic agent, but as I said before, it has been largely replaced by benzodiazepines. Other hypnotic agents that does not have a benzodiazepine structure but act on benzodiazepine receptors are zolpidem, zaleplon, and isopiglone. They don't have any anticonvulsant or muscle relaxant properties like benzodiazepine, but they have hypnotic effects. Some antihistamines like diphenhydramine, hydroxyzine, and doxylamine have sedating properties, and they are effective in treating mild types of insomnia. But because of their anticholinergic side effects, they are much less useful than benzodiazepines. Thank you for watching. Please don't forget to subscribe to this channel.